Hey guys, welcome back to our series on women's hormonal health. I'm here again with Nikiita, who's a naturopath who's very passionate about women's hormones. And this video we're going to discuss the sex hormones. So these guys play a really important role in the balance of our body, but not just for reproduction. So Nikiita, take us off. What are sex hormones and how do they impact our body?
Cool. So sex hormones impact our body in many different ways. A lot of people feel or think that sex hormones are simply just for reproduction, but they're not. They do obviously play a massive role in reproduction, but they actually play a big role in a lot of different body processes as well. So everything from our heart, like cardiovascular health, our bone health, our brain health, everything our sex hormones have some sort of role in.
That's really important.
Yeah.
I think, judging from your history as well, like the pill is the common one that gets thrown at women just because you don't want to get pregnant, have lots of artificial hormones. It does play a huge role in changing up how your body's health presents.
Yeah,
so,
massively.
So what's our first one?
So our first one is estrogen, and I feel like it's important to put estrogen first when it comes to women's hormones, because estrogen is the dominant female hormone. In men, we have testosterone, which is dominant. And the thing with estrogen is it often gets quite demonized because an excess of estrogen can have a lot of effects on a woman's body. However, it's actually really important for a lot of different processes as well. So estrogen plays a big role in our bone health and our bone formation. It plays a massive role in our mood. It plays a big role in our cardiovascular health. The reason why women often live longer than men is because we have more estrogen, and we've had estrogen throughout our whole life, so it actually protects our cardiovascular system from being damaged and stuff. So it plays a big role in cardiovascular health. It helps with the maturation of all of our secondary sexual organs when it comes to puberty. It's got a massive role when it comes to our menstrual cycle and fertility, of course. So yeah, there's a lot of positive things about estrogen. It's just when we have too much estrogen or too much estrogen in relation to our other hormones where it becomes a problem.
Yeah, interesting. Because I've heard a lot about estrogen being demonized, like, oh, get estrogen right down, but it does play a really important role. So what sort of symptoms would you find having too much estrogen and too little?
Okay, yeah, so often in today's society, too much estrogen is more common, just because we have so many things in our environment, in our foods, the way we live our life, which actually contributes to an abundance of estrogen. So this is more common for women to experience, but not always. So an excess of estrogen can result in things such as headaches even. So that's what happened with me actually with my story. When we have too much estrogen, our blood actually becomes quite almost viscous, and this actually causes our arteries in our head to actually swell to be able to circulate that thick and sticky blood, and as a result of that, our arteries actually push up against our skull, and that sort of creates that throbbing sort of sensation. So it can create headaches. You can get fat gain in places that you normally wouldn't, because we actually have a lot of estrogen receptors, particularly on our thighs, our butt, our lower abdomen, under the arms. So if you have an excess in estrogen actually sticks to those receptors in those places, and that actually holds onto fat. So you can get fat gain in those certain areas. You can get cellulite as well along with that. You can get mood imbalances. A lot of the time when someone has an estrogen dominance, they find that they have that sort of tendency to just overthink things, and they just can't let that thing go, Their mind is just racing, and they don't have that ability to switch off. That can be a common estrogen dominance sign. You can get heavy periods because estrogen actually grows our uterine tissue. Okay. So one of the things estrogen does is grow things. It can grow cancer if it's out of control, but it also grows our uterine tissue. So if we have a lot of estrogen, we have a lot of uterine tissue, and therefore when we bleed every month, there's a lot to bleed out, so that causes heavy periods. Along with that, we can get a lot of pain because too much estrogen is actually quite inflammatory, and you can imagine if you have a lot of blood as well, there might be a lot of pain because you have a lot to sort of pass through. You might get sort of breast tenderness because your breasts can actually grow because of the estrogens feeding the growth of them. What else?
That's quite a lot going on there.
I think that they're the main ones. A lot of different menstrual cycle symptoms can be caused by an abundance of estrogen.
Yeah, and so when we're thinking of too much estrogen, that is the most common way you'll find it. Mm-hmm. What sort of things do increase your estrogen?
Yeah, so that's a very good question, and there's a big list. I think, one of the main ones, well, actually there's a lot, but one way a woman might have increased estrogen is actually having increased body fat, because as well as our ovaries producing our estrogen, our ovaries are the main place where we produce our estrogen. We also produce a little bit in our adrenal glands, but our fat cells actually also produce estrogen.
Wow, that's really interesting.
Yeah, and they actually can contribute quite a lot to our estrogen production, because there's a lot of them compared to just our ovaries. So if a woman is actually holding on to more fat, this is actually going to lead to her producing more estrogen, and then that actually can create a bit of a vicious cycle, because then she has more estrogen, which holds on to more fat, and then the fat produces more estrogen, and it just goes around like that. So one of the ways a woman might have estrogen dominance is actually by holding on to more fat.
That's really interesting.
Yeah, and there is a bit of a vicious cycle, unfortunately. Another way is just the world that we live in. We're exposed to so many plastics and like chemicals and perfumes and cosmetics, and all of these things actually contain what are known as xenoestrogens in them, which are basically like chemical forms of estrogen. They actually act the same way in the body that our natural form of estrogen does, but at a much more potent and toxic level. So if a woman is constantly exposing herself to perfumes and makeup and plastic, like heating stuff up in the microwave in plastic, drinking out of a plastic water bottle, she's actually constantly consuming or absorbing these xenoestrogens, which are actually adding to her overall pool of estrogen, creating these sort of symptoms.
So it adds to the load of estrogen as well.
Yeah, and it's not a healthy form of estrogen. It's actually quite toxic, and these things can even lead to cancer eventually, and they really mess with a woman's hormones. So I feel like that's one of the biggest reasons why you see an increase of estrogen dominance these days, are these sort of environmental factors.
Yeah, that seems fascinating. And does it also come from the hormonal contraceptive pill? Is that from estrogen?
So that the hormonal contraceptive pill is literally synthetic estrogen and a synthetic version of progesterone, called progestin, which isn't quite progesterone, but it's as good as they can get. But these are literally synthetic hormones. So if you're taking them constantly, which you would when you're taking a pill, or even hormonal contraception like the Implanon, you're getting exposed to these synthetic hormones every day, so that can add to your overall sort of estrogenic load.
Wow. Yes, there's quite a lot of like environmental and physical factors to having an estrogen dominance.
Yeah, for sure.
So would there be many cases when there's low estrogen?
Yeah, so especially these days with the modern gym culture, I find low estrogen is actually, it is quite common. When a woman has low body fat, she'll actually sometimes have low estrogen. One, because she doesn't have much fat actually producing estrogen itself, and two, because her body goes into sort of like starvation mode, where her body actually thinks that she's starving because she has not much body fat, that her reproduction just gets shut down altogether, and then therefore her ovaries aren't producing estrogen.
Yeah, I've heard of that actually.
Yeah, so it's super common, and a woman will lose her period, and and as a result of that, she has very low estrogen. So that's a very common picture that I see in clinic a lot, actually.
Yeah.
Other ways are menopause. Menopause is where a woman naturally loses all of her sex hormones, or a lot of her sex hormones, so naturally as she gets older her estrogen will drop. So you'll find a lot of menopausal women experience a lot of low estrogen symptoms. And also after pregnancy, a woman can she goes from very high estrogen to very low estrogen for a bit there. But usually the main one that you sort of see in clinic is women with low body fat, or also women who sometimes they don't even have low body fat, but they are eating like a really low carb diet, and then her body actually sort of freaks out at that because it's not a fully balanced diet, and her body can actually perceive that as being starving, and then her body shuts down reproductive processes. So sometimes it can be with some women you see like the keto diet, low carb diet causing low estrogen as well.
Yeah, so there's both sides ends of the spectrum. There's quite a lot of extremes.
Yeah.
And we're wanting to be in the middle there. So estrogen's not a demon. It's we need it for health.
Yeah.
It's just the classic Goldilocks principle. We need just enough.
Literally. Yeah.
Yeah. What symptoms would you see with low estrogen? I don't think we talked about what you see if your estrogen was low.
Yeah. So low estrogen can also cause headaches. It can also cause things like skin dryness, vaginal dryness. So one of the functions of estrogen is also holding on to water and holding on to, I guess it's actually what contributes to women looking so youthful.
Skin plumpness.
Plumpness. So that's actually partly due to estrogen. So when a woman actually has low estrogen, she can actually lose this ability to retain water, and then her skin becomes quite dry. And then often in menopause you'll hear of vaginal dryness, and that's the same principle. You can also have like mood irregularities because estrogen is involved in mood, so you might feel a bit depressed or down. What else is there?
I think you discussed also the hormonal cycle, like your period cycle.
Missing period. You can get sort of weak bones as well. That's a big one. So your bones become weaker because you don't have estrogen helping with that process. That's a very common symptom of menopause as well. Yeah, they're the main ones. Oh, hot flushes is a big one as well. Hot flushes because estrogen is very involved in our temperature regulation. So that's why women going through perimenopause and menopause do experience hot flushes because their estrogen's just all over the place.
It's going up and down.
Yeah, so that's a big symptom of estrogen deficiency as well.
Cool, good.
Yeah.
Got a pretty good overview of estrogen there. So too much, not so great. Not enough, not so great.
Yeah.
Wanting some in the middle. So estrogen's our big female hormone that we're focusing. What other ones play a role in our sex hormone health?
Yeah, so progesterone would be the other female sex hormone that deserves a lot of attention. So when it comes to the menstrual cycle, we have two halves of our menstrual cycle. We have the first half, which is known as the follicular phase, which is from when you first bleed, leading all the way up to ovulation. And this is when estrogen is the dominant sex hormone. So estrogen is the highest hormone in our body during that first phase, leading up to ovulation. Then, after we ovulate, our dominant sex hormone actually becomes progesterone. Because when we ovulate, we actually, so our follicle develops, ovulation occurs, and the egg starts to go down the fallopian tube. But what's left behind is this thing called the corpus luteum. And this corpus luteum is actually responsible for producing progesterone. So we go through ovulation, we've got the corpus luteum, and then that actually produces progesterone for the second half of the menstrual cycle, from ovulation leading up to your period again. And this stage of the menstrual cycle is known as the luteal phase. So first half of the cycle, estrogen is dominant. Second half of the cycle, progesterone is dominant if you've ovulated. If you don't ovulate, you have no progesterone that cycle at all.
Wow.
Or if you're on the pill, you don't have any at all. But yeah, in a normal menstrual cycle, we have estrogen and then we have progesterone. And it's the balance of those two which creates a healthy sort of reproductive cycle. But what often happens in the second half of a woman's cycle, because we are so exposed to estrogen, sometimes we don't have good quality ovulation, estrogen can actually sort of compete to be the dominant hormone for the second half of the cycle. And that's when we start seeing things like PMS and all the symptoms that come along with it. So what we really want is healthy amounts of progesterone in that second half of the cycle to sort of balance out the estrogen. And estrogen peaks again in the second half of the cycle, but it's not as high as progesterone, if that sort of makes sense. So
yeah, that's super interesting. So that's what you were talking before about estrogen is necessary, but it has to be in relation to the progesterone of your cycle as well.
Exactly.
Cool. So progesterone is pretty awesome.
Yeah.
So it can only get produced when you actually ovulate. So what sort of symptoms do you see if your progesterone is low or non-existent?
So some things you might see is mid-cycle spotting, or even spotting throughout your period. That's because progesterone actually holds our uterine tissue in, and then when progesterone drops just before we get our period, that's actually what signals the release of the uterine tissue. So if you don't have enough progesterone, you might actually see spotting throughout your cycle, and that's an indication that you don't have enough progesterone sort of holding the uterine tissue in. Other symptoms include things like breast tenderness. That's a big sign of progesterone deficiency. You may have sort of short luteal phases, so the second half of your cycle might be shorter than 14 days, which is the amount that it's meant to be. So you might have like 10, 11 day luteal phases, which is indicative of a progesterone deficiency. You may get really bad PMS symptoms.
So the PMS side of it is when your progesterone isn't high enough to counteract the estrogen.
Yeah, like weepiness, moodiness, irritability. I'd say they would be the big ones.
Yeah.
Yeah, PMS is often a sign that you haven't got that balance between estrogen and progesterone, right? Yeah. And also an inability to conceive as well.
Oh,
so if you have fertility issues, although not a lot of the time, but some of the times it can be because of progesterone deficiency, because progesterone actually is what carries a baby. It's progestation, so it helps to carry a baby. So if a lady doesn't have enough progesterone, usually, they won't conceive because there's not enough progesterone sort of holding it in. Yeah.
That's really interesting.
Yeah.
So all of this is related to actually ovulating.
Mm-hmm.
So what causes women to not ovulate?
Yeah, good question. So stress would be one of the biggest ones, especially in today's culture and today's society. When a woman is very stressed, whether it be mental or physical, but her body is perceiving her to be stressed, the first thing to go is reproduction, because the body's not focused on reproducing, it's focused on survival. So maybe you've been gymming too hard, or maybe you had a really crazy weekend where you partied too hard, or maybe you got sick. Maybe something like coronavirus happened and you were super stressed about that. Like I know a lot of women's cycles.
A lot of mental stress can really impact physical.
So much. Like a female's body is so delicate, like you said, and I don't think we realise how delicate it can be. So I always use like my ovulation as a prediction of how healthy I am that cycle, and the cycles leading up to that as well. So stress is a big one. Nutritional deficiencies, which is also, I guess, stressful for the body. So if the body doesn't have enough nutrients, particular nutrients that it needs for ovulation, then it won't be able to ovulate. Other things are, the oral contraceptive, not just the oral contraceptive pill, but hormonal contraception shuts down ovulation altogether. That's just the way it works. So you don't ovulate, you don't get pregnant, but therefore you're not actually producing any progesterone, which has these really big, important benefits for the female body. So that is one of the downsides of contraception, is you are preventing this beautiful process of ovulation and progesterone production. The alternative that is in hormonal contraceptive, progestin, it's the closest that they could make to progesterone, but it simply doesn't have the same effects as progesterone. And in fact, it often has opposite effects in some ways. So like progesterone is really good for your hair and your skin health, whereas progestin, that can actually make you lose hair and stuff like that. Progestin actually gives you anxiety, or can in some women, whereas progesterone actually is anti-anxiety and calming. So that's another way that ovulation can be suppressed and shut down. Low body fat, like I said, extreme dieting, and then also conditions such as like polycystic ovarian syndrome, or hypothyroidism, or hypothalamic amenorrhea, which is basically when women have really low body fat or extreme dieting and stuff. So there's conditions as well that can sort of shut it down. So we're relying a lot on that ovulation for our optimal health, aren't we? Yes, I believe so.
So if we're thinking of like you're tracking your cycle and understanding your hormones a little bit better, how would you know if you have or haven't ovulated?
Yeah, good question. So there's two ways you can know if you're ovulating, like two definite ways. There's a few telltale signs that you probably are ovulating, which includes having a regular cycle. So if you're having a regular cycle, it doesn't have to be 28 days. That's the common myth, that a regular cycle is 28 days, but it can be anywhere from 21 to 35 days. But you want to make sure it's around the same amount every cycle. Then that's an indication that you probably are ovulating. Another indication is if you see egg white consistency cervical mucus around the middle of your cycle, that's telling you that your body is preparing for ovulation. So that mucus is actually part of the process of ovulation, and if you see it, you can have a sort of rough idea that your body is about to ovulate, but it doesn't necessarily mean you were successful in ovulating. So something could go wrong. But then to know that you've definitely ovulated, you can either use a positive urine ovulation stick, which is basically you just urinate on it and it says, yes, you've ovulated, or no, you haven't yet. And that measures a thing called luteinizing hormone in your urine to tell you whether or not you've ovulated yet. And then the other way is, and the way that I like to do it, is actually measuring your temperature. So if you measure your temperature every morning, around the middle of the cycle, you should actually see a spike in your temperature.
Okay.
And if you see a spike in your temperature and a sustained spike in your temperature until you get your period again, that means you were successful in ovulating, because what happens when we ovulate is we produce progesterone. And progesterone actually helps with our metabolism. It actually boosts our metabolism and increases our temperature. So if you do see an increase in temperature, then it's likely a result of that increase of progesterone, which resulted from ovulation. So if you do see that in the second half of your cycle you have a higher temperature, then you know that you've ovulated, and you can actually pinpoint when you ovulated and how well you've ovulated as well.
That's fascinating.
Yeah.
But there's so much to know about your menstrual cycle.
Yeah.
That's so important for your health. And I know a lot of women that don't know anywhere near this much about their menstrual cycle at all.
Yeah.
So let's have a little recap. So we've talked about estrogen and how that's important and plays an important role in our body. And then progesterone needs to balance it on the other side. Is that most of what we need to know about the hormonal cycle? Or what else is included?
They're the main ones when it comes to female hormones. Especially when it comes to the menstrual cycle. But we do have testosterone as well. So we don't have anywhere near as much testosterone as a man. That's their dominant sex hormone. But we do have some. And it does play a role in some female hormonal conditions as well. So commonly, or not commonly, but something that is becoming more increasingly common these days is high testosterone in women.
Oh, interesting.
And this is as a result of a condition known as polycystic ovarian syndrome. So basically, some symptoms of this syndrome include like facial hair in places that a man would usually grow hair. So not just like a little bit of fluff on your chin, but like actual like almost like thicker sort of black hair, coarse hair, maybe on your chin or your abdomen or something like that, which is known as hirsutism. You might get really cystic acne, particularly around the jawline and on the back. You may get sort of hair falling out on your head. You may find that you're storing weight, particularly around the waist area, so apple-shaped obesity, which is where you store weight, on the waist. And irregular cycles. Your cycle, you might find, is like, just all over the place, it doesn't have that regularity to it because you're not ovulating regularly. So, there are a few signs of this polycystic ovarian syndrome, which is basically, there's a few causes behind it, but one of the main causes is an imbalance in someone's insulin. So this is more of like a metabolic syndrome really, but then it affects our hormonal health. So insulin, just a quick recap, is basically what helps shuttle the blood sugar that we get from our foods into our cells. Insulin is actually what helps with that process. Now, due to so many different reasons in today's world, whether it be diet, the chemicals we're exposed to, stress, all of the many different reasons, medications, something can go wrong with this insulin and our body actually becomes resistant to the action of insulin. So we need more and more insulin to actually get blood sugar into our cells. Now, this high insulin can actually then affect our ovaries and actually stop our estrogen from converting into testosterone, and actually sort of results in a backlog of testosterone.
Oh, okay.
So, it's a few systems crossing over here, but basically this high insulin stops us from ovulating properly, and we actually get a backlog of testosterone, which actually results in all of these more, I guess you could say, masculine orientated symptoms.
So it builds up and then it'll start to present in our body.
So there's a few other causes behind polycystic ovarian syndrome. You can have it adrenally based or a few different reasons, but that's the main reason, is insulin resistance. And then these women will find that they're not ovulating properly, and they've got all of those symptoms that I just spoke about. And a lot of doctors or medical people sort of just focus on the testosterone bit, and they just give a pill and they're like, that'll suppress the testosterone. But it's not actually focusing on what's the underlying cause, which is actually a metabolic the imbalance, not more so than a hormonal imbalance. So once you sort of know about the condition, it can be very, you can be very successful at treating it with different lifestyle and dietary interventions. But yeah, it can be quite, upsetting for a lot of women who do have this condition.
Yeah, and it can definitely cross over with lots of the other symptoms as well.
Yeah.
Cool. So it's mainly estrogen, progesterone, and testosterone that play roles in the sex hormones of a woman.
Yeah.
That's fascinating.
Yeah.
So now let's think about where we can get started. So if you're a woman wanting to understand your sex hormones a little bit more, what would you do?
So yeah, like I mentioned before, it'd be a really good idea to do that quiz that we've posted, just because then you can sort of have a really good idea of where you might be sitting. And then I feel like the best way to sort of hone in on your specific situation is probably working with a practitioner, like a holistic practitioner who can help assist your specific sort of situation and sort of get to the bottom of what's going on with you, because there's a lot of basic things you can do for hormonal balance, but sometimes you do need a little bit of extra help as well.
I think you also mentioned just tracking your cycle. It sounds so simple, but if understanding when you start your cycle and maybe seeing if you're ovulating, that would be great to help bring along to see what you're currently doing.
That's perfect. When I have a woman who's done that, usually I'll get women to come see me and I'll get them to do that, and then I'll come see them. They'll come see me again, and then we have a really good idea of where they're at. So yeah, that's a great idea to do that. Yeah.
I think that'd be really powerful to understand what your body's currently doing and also what symptoms are arising.
Yeah.
It's very easy. Some of these things are very subtle, and like overlooking them might be one of the biggest things that you need to know about your health.
Yeah, for sure. Yeah.
Awesome. Well, that was an awesome look at hormonal health in regards to the sex hormones. There is so much going on there, but like you said, once it's balanced, your body has such a massively resilient place to go from. So we want to make sure we're getting those hormones balanced.
For sure.
Cool. Hopefully you guys learned quite a lot there about sex hormones. Again, if you need to look into them a little bit more, I would highly recommend doing that quiz, checking in with Nikki, and start tracking your cycle just to see where you're currently at. Only thing will be, if you're a menopausal woman, what would you do? Tracking out symptoms maybe?
Track your symptoms. You can track your cycle if you're in perimenopause, you're still getting somewhat of a cycle, you can track that as well. Perimenopause and menopause can manifest very differently for every woman. So I think once again, tracking, getting to know what's happening with you, and then probably working with someone who can sort of help you out, depending on how severe your symptoms are. There's a lot of basic things that you can do as well, like, staying away from alcohol, reducing your coffee, eating right, training, sleeping right, like all of those things which are across the board important for everyone that you can do for menopause. But if you're experiencing more specific things, then just tracking it and then seeing a holistic health practitioner who can help you out.
Awesome. And last thing will probably be, so we've talked about everything. What were your biggest recommendations to balance out your cycle?
Yeah, cool. So, like I said, it can be very individualized, but on a broad spectrum, you want to make sure that you are not exposing yourself to these chemicals that I've talked about. So you really, just do not microwave things in plastic, microwave things in a ceramic bowl, or that's one of the worst things you can do. Don't drink out of a plastic water bottle. Really avoid plastic as much as you can. You don't want to be consuming it. Same thing when it comes to your makeup. You don't have to be absolutely anal, but it's a good idea to at least be conscious about what products you're using contain what, and maybe slowly make the transition to natural products in the places that you're happy to do that in. So maybe you want to use a natural deodorant, or you want to try natural conditioner or something, but slowly making that transition to more of a natural based cosmetic routine. I find that's a big one. Perfumes, you can use essential oils or other things. I often find women who have a lot of estrogen dominant symptoms, they come in wafting like perfume, and it's no wonder you're feeling this way. Really be conscious about your external environment, how many chemicals you're being exposed to. You then want to make sure you're having a diet full of a lot of fibre, a lot of green leafy vegetables as well. So one of the ways our body actually helps detoxify estrogen is a chemical in cruciferous vegetables, which is broccoli, cabbage, Brussels sprouts, kale, cauliflower. So during menstruation, we're not really meant to be exercising as hard as we would usually because one, our hormones are flatlining, so we don't have any hormones to fall back on when it comes to our energy production, and two, our body's going through quite a stressful, strenuous process actually getting like bleeding and all of that. So it's a really good time to actually slow down and not do such heavy exercise. Like, it's okay to move, it can be quite beneficial to move actually when it comes to period cramps and whatnot. You know, slow yoga or a slow walk or something like that. But when it comes to really aggressive exercise, like, I really find when women avoid that during their menstrual phase, that they actually have a lot more energy throughout the rest of their cycle. They actually perform a lot better throughout the rest of their cycle, and they don't get as many period symptoms because they've actually respected their cyclical fluctuations of their hormones. So yeah, I feel like exercise is very important for hormonal balance, but it's about doing it in a way that respects the female body as well. Because otherwise we can result in things such as missing periods or acne or cortisol imbalances, because we're just burning the candle at both ends constantly when the female body's just not meant to do that. And inversely to that, it's actually really exciting because when we're ovulating as a woman, we're actually super strong and super resilient, and it's like we're significantly stronger during that time of our cycle. So you can actually plan your training around your menstrual cycle and actually get the most out of each phase instead of
good time for a PB week.
It's always the best time for a PB week. And that way you're not beating yourself up when you're going through menstruation like, oh, I'm not that strong this week. You can actually have that compassion for yourself and be like, I'm not meant to be strong this week, and I'm going to actually give myself love and the time that I need to recover, and then you can actually hit your goals during your next couple of phases.
Awesome. The common theme here seems to be that Goldilocks principle. We need to be finding that just right balance of not too little, not too much, so that we're keeping our bodies healthy and happy and balanced.
Cool. For sure.
Well, that was awesome, guys. Make sure you watch out for our next video. So this is just the sex hormones part of the hormone balances within our body. We want you to have a really good understanding of these different aspects and how they affect your health, so you can work in the best way possible to balance yourself out.